Welcome to the Unit 5 module review. My name is Dr. Lori Coring and I'm one of the course instructors in this course. Without further ado, let's get started. This recording will provide a brief overview of Unit 5. There are 3 broad learning objectives which span a wide variety of topics and several chapters of reading. The first learning objective is that you will be able to evaluate the impact that racial, ethnic, and cultural influences have on acute and chronic health outcomes. Second, evaluate how age and development affects a patient's ability to manage acute and chronic disease processes. And last, evaluate the impact that social determinants have on health outcomes in patients with acute and chronic health conditions. The end of unit quiz will assess your knowledge of the Unit 5 content, which I highly recommend. Before progressing to the next unit, a CPE check allows you to evaluate Phase 2 of the CPE deliverables. This recording will not review CPE requirements, so please check out the course tips area for additional tutorials and resources to help you successfully complete the CPE. I wanted to review the Unit 5 competencies and the subtopic areas that will be included on the objective assessment. The first topic is community influences on health outcomes. Second, influence of inherited traits, ancestral variations, and culture on patient outcomes. And third, special considerations for pediatric and geriatric patients. 20% of exam questions will be comprised from these 3 subtopic areas. To get a better idea of what type of course content each of these 3 subtopic areas represents, you can access the coaching report after taking the pre-assessment. Click on the topic titled Lifespan and Ancestral Variations. These subtopic areas will populate underneath, and then to the right, the hyperlinks titled Review will take you to the course of study where that content is reviewed. Now let's start with some practice questions related to the first learning objective. How do racial, ethnic, and cultural variations affect health outcomes? Despite significant advances in the diagnosis and treatment of most chronic diseases, evidence demonstrates that minority populations continue to have worse health outcomes, higher mortality rates, and increased health morbidities when compared to non-minority populations within the United States. The cause of this disparity is multifactorial. Minority populations have decreased access to care due to financial or social constraints, and when care is provided, minority populations have additional challenges in finding healthcare providers that provide high-quality care. In populations where healthcare challenges are present, there is a proportional increase in the prevalence of preventable diseases and injuries. Are there complementary and alternative therapies you should discourage a patient from using? Examples of complementary and alternative therapies can include Reiki or energy healing, herbal therapies, chiropractic, or acupuncture practices. While these therapies can be beneficial, the main disadvantage that prevents integration of these modalities are the lack of evidence-based research that demonstrates safety and efficacy in maintaining health or treating pathology. This makes recommendation of these therapies contradictory to modern healthcare practices that embrace evidence-based methodology. Moving on to the second learning objective. What effect does aging have on the ability to exercise? As we age, there are several degenerative changes that take place in nearly every body system. For example, decreased muscle mass, decreased mineral content, decreased integrity of our bones, decreased metabolism, and then deconditioning of the cardiovascular system, which makes endurance efforts even more difficult than they once were. The amazing thing is that routine exercise throughout life can counteract these degenerative changes. It's never too late to start exercising as a primary way to maintain optimum health. Next, is osteoarthritis a normal process of aging? Guess what? It's not. Even though it seems like arthritis is an inevitable part of aging, it isn't. It's actually connected to that degenerative process that each person has control over, which we just discussed in the previous slide. If we can halt or minimize the magnitude of degenerative processes occurring in our body through healthful activities like good nutrition and exercise, we can prevent chronic diagnoses like arthritis, which plague almost 50% of adults older than 65 years of age. Next up is learning objective number 3. What are the social determinants of health? Well, according to Healthy People 2030, social determinants of health are defined as conditions in the places where people live, learn, work, and play which affect a wide range of health risks and outcomes. These conditions are known as social determinants of health. There are 5 domains which I would recommend checking out on the Healthy People 2030 website. They are health and healthcare, economic stability, education, social and community context, and neighborhood and built environment. Each domain has specific variables that influence every individual's ability to access healthcare and the ability to maintain health. What are the goals of the Healthy People 2030 organization? To be precise, Healthy People 2030 objectives are data-driven objectives designed to improve health and well-being, tackling at-risk populations, environments, and health conditions which lead to morbidity and mortality in the United States. These objectives are created every 10 years with a decade timeline for improvement. Next question is, what are the goals of drug therapy in a community? Medications are used as a typical strategy to manage both acute and chronic health conditions. However, each year, thousands of citizens in the United States will die as a result of a medication error. Medication errors take place in both healthcare and home environments. With prevention as the priority strategy in this national crisis, many initiatives are taken to promote the positive outcomes of this common healthcare modality of prescription drug use. In Chapter 3 of the course textbook, the following initiatives are identified and discussed in greater detail. Patient education is key, especially the comprehension and understanding a patient has regarding a drug's necessity, administration technique, side effects, contraindications, and monitoring practices. This variable alone can be the difference between life and death. Second is monitoring. Once a medication is started, the healthcare provider team must ensure effectiveness and safety of the drug. This involves routine follow-up with physical examination, objective assessments, which might include repeated vital sign measurement, laboratory testing, or symptom assessment. According to the text, approximately $290 billion are spent each year for consequences of medication non-adherence. There are a variety of reasons why medications may be discontinued or not used as prescribed, but education is largely a key variable in the cascade of outcomes related to non-adherence. Last is management of medication therapy, otherwise known as medication reconciliation. This is a process of routinely assessing the necessity of each medication listed on the patient's medication list. That wraps up this Unit 5 review. I wish you the best of luck on your continued academic journey.